Hello everyone and welcome back to my playlist of Gynecology from 10 Teachers. My name is Professor Asif Qureshi and you are watching Dr Asif Lectures. हम 10 Teachers से Gynecology कर रहे हैं. Today is chapter number 6, day 6. And the topic today is contraception and abortion. So contraception is basically all those methods by which you try and prevent the fertilization process, okay? So even if the sperms are entering, even if the ovum is being released, so ovum and sperm are there, but you are then exercising or implementing such procedures by which they do not fuse, or even if they fuse, they are not effective, right? So this is called contraception, which is by definition a process where you stop the process of fertilization from happening. And then abortion is once they have fused, once the zygote is produced, now you want to destroy the zygote by different means, and that destruction is then known as abortion. तो ये दो basically अलग-अलग चीजें हैं. एक में we try and stop the fusion of the gametes, ovum and sperm मिलेंगे ही नहीं, and no zygote formation, that is contraception. And the other one is abortion. So one in a way is preventive for pregnancy, so this prevents zygote formation, and this is then getting rid of the pregnancy, abortion, okay? So the learning objectives of today's chapter would be to understand the mechanisms of action of currently used contraceptive methods. We will talk about different techniques to stop or prevent the zygote formation. We should be able by the end of this lecture to describe the factors that affect contraceptive effectiveness, which type of contraception is more effective than the other, understand the non-contraceptive benefits of methods, remember the use of medical eligibility criteria for contraception, understand, so basically all about contraception we are going to talk today, and then also details of abortion, okay? Right. Now, there's a term called post-abortal contraception. We'll also touch upon that concept. Correct and consistent use of effective methods of contraception can prevent most unintended pregnancy. So unintended pregnancy word use करते हैं कि when the couple is having intercourse and they do not plan to have pregnancy, but even if without their planning and without their will the pregnancy happens, this is what we call the unintended pregnancy. So usually those who do not intend to get pregnant, they use contraceptive methods. So in most of the cases, contraception is enough to prevent any unintended pregnancy. Abortion is a major consequence of an unintended. So if somebody, despite all the precautions, they have an unintended pregnancy and they want to get rid of the pregnancy, this is what we call abortion, okay? And in many low and middle income countries that restrict abortion, abortions are often performed under unsafe conditions. So ये particularly बात कर रहे हैं अब low and middle income countries की, because developed world में the use of contraceptive methods is pretty advanced, and even if with the use of these contraceptive methods, if there is any unintended pregnancy, abortion is not a myth or a taboo in the developed world, but in many low income or middle income countries, that is a problem, and many families just do not are ready for the abortion. Therefore, they continue the pregnancy, and since this is an unintended pregnancy, they were not planning this pregnancy, that becomes a matter of discussion. Unintended pregnancy can also lead to delayed or no antenatal care because this was unintended. So जिस तरह का care usually आप एक planned baby के लिए करते हैं, उस तरह का perhaps बास countries में फिर लोग नहीं कर रहे होते हैं, और फिर उससे infants associated और even maternal associated risk factors बढ़ जाते हैं, मुख्तलिफ mortalities, morbidities के. It is estimated that there are 22 million unsafe abortions each year. When we say unsafe abortions, इसका मतलब ये है getting rid of the pregnancy, but not according to medical standards. Approximately 47,000 deaths from unsafe abortion. It's a big number per year if you consider. And 5 million women suffer injury or disability from unsafe abortion. So this is a big number where unsafe practices for abortion are leading to big childhood and maternal mortality. and they're all preventable through contraception. Because to begin with, this pregnancy जिसकी केयर नहीं की जा रही और abortion किया जा रहा है, so this is basically unintended pregnancy जो the couple never wanted this baby, and therefore they are aborting the baby. So this can all these mortality, maternal injuries, baby injuries, they can be prevented by contraception. तो अगर start में contraception methods use हुए होते हैं, so ये unintended pregnancies result नहीं होती, ये नहीं होती, abortion नहीं कराना पड़ता. Okay. Now, global unmet need for contraception. Over 200 million women worldwide would like to avoid a pregnancy but are not using an effective method. So this is a study where they talk to people. They would like to avoid pregnancy by using appropriate contraception, which is not being used. This can be because of so many reasons. There can be supply issues in some countries, cultural issues, political barriers. There are some countries where they have a slogan कि जी ये क्यों आबादी control कर रहे हैं. There are cultural stuff. So many things. It's a complicated topic. Estimated 22 million unsafe abortions each year. देखें, एक तरफ तो कॉन्ट्रासेप्शन नहीं यूज करने दे रहा है, दूसरी तरफ अनसेफ अबॉर्शंस भी हो रही हैं. इट्स अ बिग नंबर यार, 22 मिलियन ईच ईयर. इसका मतलब एटलीस्ट अगर नंबर्स ही पे हम देखें तो 22 मिलियन अनइंटेंडेड प्रेगनेंसीज तो थी ना जिनको अबॉर्ट किया जा रहा है. अप्रॉक्सीमेटली 47,000 डेथ्स फ्रॉम अनसेफ अबॉर्शन, अगेन अ बिग नंबर, एंड 5 मिलियन वुमेन. तो ये मैं वही बात कर रहा हूँ कि ये सारी जो मोर्टेलिटी मॉर्बिडिटीज हैं ये कंट्रोल की जा सकती हैं जस्ट बाय यूजिंग appropriate contraception. Because you use it correctly, you do not have unintended pregnancy, and hence you do not have all these mortalities and even morbidity. Contraceptive targets in the female reproductive tract. That's now beginning of very important discussion. In order to prevent pregnancy, contraceptive methods could be developed to target one of the number of key reproductive processes. If you recall, जो reproductive processes हैं, they are divided into multiple layers. The first one being the development of the follicle from the ovary. Then it comes out. It is received by the fibria and then the fallopian tube, and then it goes to the uterus, and somewhere in the fallopian tube here the fertilization happens if sperms enter at the time of ovulation, right? So ये पूरा cycle अगर आपको याद है, then you will understand कि किस किस stage पर you can manipulate and undertake contraception. और अगर ये बात आपने समझ ली, then you understand the mechanism of action for many of the contraceptive procedures, right? So these contraceptive methods can be developed to target one or the number of key reproductive processes, more commonly in the female genital tract, but that can also be done in the male reproductive tract. None of the existing methods of contraception are 100% effective. आप ये नहीं कह सकते कि there is 100%, but they are very, very effective. The effectiveness of method depends on both the mechanism of action and correct and consistent use. This is the key. So I would say technology-wise things are very nice. So for example, simple use of condom. अभी हम थोड़ी देर में बात करेंगे. That's a physical mechanism and physical barrier to contraception. Over the penis there is a male condom, and during the process of intercourse, even if the sperm is released inside the vaginal tract, because there is a physical barrier, sperm doesn't get out. So, and condoms have been prepared and used for a long time, decades and decades, and it's been very effective. But if they are used effectively and consistently, यानी कि आज use किया कल नहीं किया, या during the course of intercourse at some point you remove the condom and things like that, so if you are not using it appropriately, if you are not using it consistently, then this is not the problem with the manufacturing of condom, perhaps this is the problem of with its usage. So compliance बहुत important है. It depends on the acceptability of the method to the user and tolerability with any untoward effects that they experience related to the use of method. So this word is very important. Now either you are using a simple mechanical barrier, physical barrier, or you are using some drugs which inhibit ovulation, for example. The compliance is important. जो उसकी गाइडलाइंस हैं उसी तरह से उसको यूज करना है. Even in very well developed countries, in high income countries such as the UK, where contraception is free, and this is really free in UK, and a range of methods are readily available, unintended pregnancy rates still remain very high. So that's a challenge. Okay, many women who present with an unintended pregnancy have used a method, but it usually is a method of low effectiveness. They call it condom, low effectiveness. To me, this is really high effective method if used appropriately. This is very important. or a method that has been used incorrectly or inconsistently, such as they are using the contraceptive pills but they are missing their pills. Uptake of existing method is limited by their acceptability to women. For many method, discontinuous rates are high. So यहाँ पे जो पॉइंट ये हाईलाइट कर रहे हैं वो यही है कि even very effective methods exist, but if they are not used appropriately, there's a problem. A woman's choice of contraception is just like as likely to be passed upon information from media, friends, family. So this is actually like an important healthcare issue which is not discussed by the healthcare providers. It is, based on media perception and what friends and family say. The most effective method of contraception as long-term reversible methods of contraception, इनका नाम abbreviate किया जाता है LARC, LARC methods. So called the fit and forget method, such as the contraceptive intrauterine device. Now, this is something अभी हम पढ़ेंगे इन सब के बारे में. This is something which you fit and then forget. So inside through the vagina to the cervix and up to the uterus, you use a device which is intrauterine device. You just fix it, and this is enough for long-term contraception. Okay, we also have LNG intrauterine system, which is levonorgestrel and progesterone only implants. So these are primarily implants which you actually get fit into via the vagina to the cervix and to the uterus, and then you are once you fit it, once you install it, you are good for a very long time. Okay, unfortunately, myths and misconceptions amongst both women and healthcare professionals surrounding the use of LARCs are major factor limiting. So they are very worried कि यार पता नहीं क्या चीज use कर लिए क्या. So there are so many myths associated with that. Education, dispelling myths, and promoting the significant non-contraceptive benefits of LARC can improve the use of LARCs. Okay, mechanism of action. The current अब ये कुछ हमने they were important. ये अब जो bullets आने वाले हैं, these are very high yield bullets, because now we are going to talk about what are the different modalities available in terms of contraception. So मैंने आपसे बताया था कि there are different stages: ovulation, then movement of ovum into the fallopian tube, and then fertilization happens ना. तो ये किस पहला stage जो हम discuss कर रहे हैं, disrupting ovulation. So preventing ovulation, there are drugs which stop the process of ovulation. तो जब ovum ही नहीं निकलेगा तो ज़्यादा contraception भी नहीं होगी. This is the mechanism of action of the following methods: combined hormonal pill, there are progesterone only injectables, there are implants available, and oral emergency contraception, which means you had unprotected sex and now you want to prevent, so this is emergency pills. And lactational anemia, that is anyways a physiological condition. इसका मतलब ये है कि once a baby is born, एक छोटा बच्चा पैदा हो गया है, now the female is lactating, and during that lactating time, the levels of milk hormones are very high, which are inhibiting the hypothalamo-pituitary ovarian axis, so menstruation doesn't happen. So if menstruation doesn't happen, there is no ovulation. So that's a physiological window where natural contraception is in practice. Then, so this was preventing ovulation. Another thing that you can do is prevent the sperm to reach to the ovum, right? और इसमें फिर multiple चीजें की जा सकती है ना. For example, इसमें condom use किया जा सकता है, which is a physical barrier to sperm. And then more serious stuff, do the female sterilization or the male sterilization. Remove the the tubes. अगर fallopian tube को मैं block करता हूँ या मैं vasectomy करता हूँ, so the sperms are not getting out. In case of vasectomy, they are not reaching to ovum in case of female sterilization. So you're preventing the sperm reaching there. Preventing an embryo implanting, and now once the embryo is produced, then we have these intrauterine systems in place. They do not allow the embryo to develop anyways. Now there is a debate in there. This is a real contraception or abortion. Technically, once the embryo is fit into the uterus and it starts growing within the uterus, this is where the pregnancy has been held, or इसको अगर निकाला जाए तो this is called abortion. But these devices are working at the stage of implantation. They do not allow the ovum and the sperm which were fused and formed zygote, उसकी entry uterus में ये stop करते हैं. So these are the devices which are technically speaking contraceptives, right? Allow sperm into the vagina but poison them. So there are spermicides which a female or male can use, and the sperms enter but they die. Allow sperms into vagina but lock the further passage. So this is where the diaphragm or a cap, so female diaphragm, female condoms or male condoms, prevent sperm entering the vagina, again male and female condoms, ये diaphragm अंदर insert होता है जिसमें ज़ाहिर है over the penis कोई condom वगैरह use नहीं हो रहा, but this diaphragm prevents the further movement of sperm into the female genital tract, although these are the ones जो कि sperm को release ही नहीं होने दे रहे ना into the female genital tract. These are the use of condoms, and avoid sex during the fertile time, because sometimes if low quality condoms, for example, or inappropriate use, that can be a problem, leakage of sperm, right? Fertility awareness based method. So this technically is well, this is, if you are very confident you can take care of the dates very carefully, then use this method, otherwise not. Basically इसका मतलब ये है कि we know that every 14th day of the cycle is usually the time period when the ovum comes out, right? So avoid 3 days here and 3 days there, which means up till 17 days here and up till 11 days. So don't have sexual activity between these between this window 11 to 17 days, and well, very safe would be do it after day 20 of the menstrual cycle or before 10. तो बिफोर 10 का मतलब ये है कि डे 1 से तो ब्लीडिंग हो रही होगी, which is around 4 to 5 to 7, so you have like 7 to 10 days there. This is the window to do protected sex, and then from 20 to 28, this is a window here. So a week there and a week there, you have got time. Leave the 10 days in the middle. That is what is called fertility awareness based method, right? Alright, now ये अब है बस सारे different methods जो contraception के हैं. So you are either intervening at the level of ovulation, or you are trying to stop the fusion of ovum and sperm by various mechanisms. The efficacy of a method depends upon the mechanism of action. However, real life effectiveness depend on compliance. And मैं बार बार ये बता रहा हूँ, although book आपको बाज़-औक़ात mention करेगी कि condom is a low effective method, but if used appropriately, this is one of the best methods available, right? So compliance बहुत important है, understanding बहुत important है. Failure rates during perfect use show how effective method can be. Where perfect use, well, the point here is that whatever the however effective method you use, there are chances of failure. Okay, we'll go through this table in a while, and then we'll talk about different methods, right? So it's a percentage of women experiences an unintended pregnancy. So if no contraceptive method was used, no method was used, they were simply having random intercourse. So unintended pregnancy rates are very high, 85%, obviously. So those who are using only male condoms, 18%, female condoms, 12%. So this is reduced very, very low, you see, from 85 to 18. But still, with the use of condoms, there are unintended pregnancies. But I would then question the appropriate use of condom here. Pills, progesterone only 9%, combined hormonal contraception 9%, progesterone only, and look at these devices, intrauterine devices, very, very low. So looks like they are highly effective, but many people think, well, there is something in my body, it's a sort of implant, it will lead to infection, there will be long-term complications. But these are myths, many of them. So appropriate use of these can reduce unintended pregnancy this much. The implants, and then if you sterilize, even with sterilization, there is a small chance that unintended pregnancy can happen, but the chances have reduced so much. See, this part of the table tells you that these are highly, highly effective procedures. Okay. LARC have been defined in the UK as the method that required administration less than once per month. So every 1 month you have to do some intervention in there. Although in many other countries injectable is not considered as LARC, so injectables are a month up once, like devices agar aap sirf input kar rahe hain, so they are like once installed and then you forget about them. But if you're using injectables, there may be a fixed time period where you have to inject them again and again, such as monthly. LARC methods, these are long-term methods, are most effective as once inserted they do not require any action, so they are there. In contrast, shorter acting methods to require compliance by the user. So agar daily pills leni hai ya condom use karna hai, so these are very much user dependent, how the user is using them, right? This is very important. LARC methods have typical failure rates as well within the first 12 months if they are not inserted appropriately, or if there are any other issues such as it is removed. Some patients try removing it themselves. We have had cases like that. So कोई भी आप method use करें, compliance to that particular method and appropriate use. ये दो words आपने याद रखने हैं. Then any method will be successful. Most women, safety wise बात करेंगे, who use contraception are fit and healthy. However, some health conditions may be associated with real or theoretical risk of particular contraceptives. In an attempt to produce a set of international norms for providing contraception to individuals with a range of medical conditions, the World Health Organization has developed a system of medical eligibility criteria. So ये जो medical eligibility for contraception है, it's a guide के there are some checkpoints जो आपने देखने हैं, right? So MEC1 is a condition for which there is no restriction for the use of absolutely fit person, right? Versus 4 is a condition that represent an unacceptable health risk if the contraceptive method is used. So for example, if somebody is given pills which contain estrogen and progesterone and the patient has obvious and serious contraindications to the use of estrogen, for example, you would label for that particular contraceptive, you will label the patient as MEC4. But if that patient is using, for example, condom, so for condom use, that the same patient may be MC category 1. So it basically goes with what is the type of contraception that you are using, and in that particular context, what is the category of the patient, right? Interaction with other medicines, there are a number of medicines, particularly antifungals, retroviral and antibiotics and some anticonvulsants. Now these are very important. Reason ये है क्योंकि ये जो सारे अभी मैंने नाम आपके सामने लिए हैं, they are all the inducers of liver P450 cytochrome system, and this will then reduce because this system once induced, it will reduce the it will increase the metabolism and reduce the efficiency of hormonal contraception, right? So this is an important correlation to understand. If a woman using enzyme inducing medication wishes to use one of these hormonal methods, यानी अगर इनमें से कोई medicine use कर रही है female और उसे hormonal method use करना है, then the consistent use of condom is also advised because their oral contraceptives may not be very effective. So you see how you have to actually evaluate your patient. There is no one fit and final answer which fits everyone. ऐसा नहीं है. Medicine is very much contextual, आपको ये बात समझनी चाहिए कि medicine बहुत कॉन्टेक्स्ट बेस्ड है. हर पेशेंट डिफरेंट हो सकता है, एक ही फॉर्मूला सब पे नहीं लगता. ओके, नाउ एग्जांपल्स ऑफ WHO मेडिकल एलिजिबिलिटी क्राइटेरिया, category 4 conditions and use of combined oral contraception. So ये आपको याद रखनी है कि these are the ones labeling patient category 4 for contraceptions which are particularly hormonal combined contraception category. So if there is age more than 35 and the person is smoking, that's category 4. Be aware of this. High blood pressure, hypertension and vascular disease, they are also both of these associated with smoking and high blood pressure. DVT और पहले हुई हो या current DVT है, MI, cerebrovascular accident, these are occurrent breast cancer, these are all category 4 patients. High risk patient for hormonal contraception. So keep that in mind, okay? Drugs known to decrease the efficacy. So if you are using anticonvulsants, antibiotics, antifungals, and antiretroviral, and here are the names of the drugs. They will all interfere. They will reduce the efficiency or efficacy of hormonal contraceptives, right? So बेहतर ये है कि अगर ये drugs use हो रही हैं और आप hormonal contraceptives use कर रहे हैं, the use is not absolutely contraindicated, but ये याद रहे कि इनकी efficiency कम हो जाएगी, which means combine them with some other method of contraception, such as condoms, right? Are there any side effects? I would say yes. Every drug basically comes with a side effect. Why not? Medicine है यार ये. Common side effects that women report with all hormonal methods are unexpected bleeding, some weight gain, mood swings, headache, and loss of libido. These are common side effects. Concern about weight gain and women attributing weight gain to hormonal contraception have been shown to be one of the greatest perceived disadvantages. So you're taking contraceptions and then gain of weight. Not good. There is no good evidence that hormonal contraception has adverse effects upon libido, but this is one of the myths. But there are some studies supporting the idea as well. Unexpected bleeding is also very common in 15% of the patients. So these are common side effects, right? Non-contraceptive health benefits. So if you're using these drugs, what are other benefits? Other benefits, for example, for this intrauterine system, which is levonorgestrel based, can be, benefit the process many females experience heavy menstrual bleeds, so it can be beneficial for that. Endometriosis, so these are all the diseases which can be benefited by this. So these are not related to contraception directly, but they are also important benefit of this system. And then combined hormonal contraception also controls, you see, the polycystic ovarian disease में भी हम ये use करते हैं, we have talked about it. Progesterone only injectables also are beneficial against these problems. Okay. Now, determinants of contraceptive method acceptability. Which contraceptive method to prescribe to which person? There's so many factors to consider, such as personal characteristics. What is the age of the person? So, for example, if the age is more than 35, I'm already knowing that for hormonal contraception, this person falls under MEC category 4. इसी तरह fertility intentions क्या है? अगर हो जाए pregnancy, तो is it okay with them, or they do not want pregnancy? Absolutely, they don't want it to happen. Then you would be very cautious. तो ये सारे वो फैक्टर्स हैं. फेमिलियरिटी, पहले कभी यूज़ किया है वो मेथड, कॉन्डम्स यूज़ किए नहीं किए हैं, साइड इफेक्ट्स का डर कितना है, व्हाट आर द पेशेंट्स परसेप्शन फॉर सेफ्टी, एक्सपीरियंस ऑफ अदर्स, हैव दे हर्ड अबाउट इट, अगर उनको कभी ये पहले यूज़ करना पड़ा है तो कोई हेल्थ केयर एडवाइस ली उन्होंने नहीं ली है, उनको इन बेनिफिट्स का पता है जो नॉन कॉन्ट्रासेप्टिव, यानी एक पेशेंट अगर आपके पास एंडोमेट्रियोसिस के साथ है या से फॉर एग्जांपल PCOS के साथ है, तो मे बी कंबाइंड ओरल कॉन्ट्रासेप्टिव ड्रग्स आर इंपॉर्टेंट फॉर देम. तो ये एक तीर से दो निशान है. ये कॉन्ट्रासेप्शन में भी हेल्प कर देगा एंड इट विल आल्सो हेल्प कंट्रोल PCOS, राइट? So there's so many factors that you have to actually consider before you prescribe a particular contraceptive method to the lady or to the couple, right? So अब तक हम जो बात कर रहे थे, that has set down the ground for understanding a lot more discussion which is coming up next, because अब हम थोड़ा सा डिटेल में बात करेंगे जो की contraceptive methods हैं उनके mechanism of action की, how do they actually work. So for example, our first discussion will be focusing on combined hormonal contraception. When we talk about combined oral contraception, basically means that these contraception technology or methods or pills, they have two different hormones. One is estrogen and the other one is progesterone, and they are available in different formats. So for example, there are oral pills available, there is a transdermal patch available जो आप transdermally लगाते हैं, and also vaginal ring. They are all equally good. Also depends upon you discuss this with the patient and what is their priority, then accordingly you use any one of them. And how they basically work, they inhibit the process of ovulation. So they work at the step of ovum release, because they inhibit this process by negative feedback. And estrogen and progesterone, on the pituitary can suppress the levels of FSH and LH. And if you suppress the levels of FSH and LH, you are technically inhibiting the process of ovulation. So if we talk about pills, most of the commonly used contraceptives are low dose, and they contain ethinyl estradiol in a dose which is as small as 15 to 35 micrograms. And there are some newer pills which contain estradiol valerate and estradiol hemihydrate, which is more similar to the structure of the previous chemical, but confers no other proven benefits. So it's a purely contraceptive type of thing. Most traditional preparations contain 21 pills, followed by a 7-day pill-free period. So they have a like packet शायद इन्होंने diagram भी दी होगी or something like that. So this is the typical oral contraceptive pill packet, colored, and then 1, 2, 3, 4, 5, 6, and 7 drugs which you take as a placebo. There's nothing in there, right? They are pill-free period. So some preparations contain 24-day pills also, with a shorter pill-free period. इस केस में ज़ाहिर है 3 या 4 दिन आपने pills नहीं लेनी. So it depends upon the manufacturer guidelines. Preparation are commonly monophasic, that is same dose of hormone throughout, but preparations there are also which are biphasic or other multiphasic preparations. Although traditional, which is 21 days on the pill and 7 days off the pill, result in a withdrawal bleed during the pill-free interval, and that's the normal menstrual cycle which happens. There is no reason why women cannot take pill continuously. They can. Women with dysmenorrhea or headaches during the pill-free interval often are advised to do so to avoid recurrence of the symptoms during the hormone-free interval by tricycling, taking 3 packets without any break. So It really depends. मैं बार बार ये बात कहता हूँ कि you are dealing with a patient, so you have to take care of how the patient is responding to the drug. Some patients are fine with 21-day drug and 7-day free period, but some have serious symptoms in this 7-day drug free period. So इस case में you just continue the drug. So you can do that, okay? The progesterone, and whenever they want to start the bleed, for example, you just go onto the pill-free period, and they have the bleed. So this is where women continue to take the pill until they want to start a bleeding episode, and you just go off the pill and you bleed. Okay. The progestins that are used in currently available pills are often referred to as the second generation, which are, so ये अब जो हम बात कर रहे थे, this was about the estrogen, and now the progesterone part of it, these are levonorgestrel or norethistron. There is also third generation drugs available such as gestogen, dogestrel, or fourth generation. There are even newer generation combination of the above. So many options available basically, right? In view of this, combined oral contraceptives containing second generation progesterones are generally recommended because it seems that the higher generations are associated with higher risk of venous thrombosis. So second generations better. So this was about the pills, right? The important takeaways, the most traditionally used is a 21 days on pill plus 7 days off pill type of setup. And you should know that this is the time, the pill free period, when the females go on a bleeding episode. If they won't go on pill free period, if they don't, continue the pill. Okay. This can also be important, particularly in certain scenarios when the females particularly do not want to bleed, such as, for example, if somebody is going on their religious activity, such as Hajj or Umrah in particular religious community, they want their menstrual cycle to be stopped for that particular time because they want to pray as much as they can. So this is then the option. Go on the pills for longer time, right? Patch and ring. Now these patches and rings are also available. I told you earlier कि जो ये भी hormonal release है. They are also combined hormonal stuff. They can be used as a transdermal patch or as a vaginal ring. So they also release यहाँ अमाउंट पर्टिकुलर लिखा हुआ है, ये आपको याद रहे तो ठीक है, ना भी याद रहे तो भी ठीक है, बट यू शुड नो कि व्हाट डू दे रिलीज एज अ कॉम्बिनेशन ऑफ estrogen and progesterone stuff. Okay, the patch is applied to the skin on the lower abdomen, buttock or arm for about 7 days, although it can be applied to the skin of to any covered area, but except for breast, right? But this is these are the usual sites where you can use it. The regimen usually involve application of the patches for a total of 21 days, 7 days each lifetime. Continued use, tricycling or tailored use is also possible. Some women may experience problems with the patch. So patch sounds like you are inserting something. So many women just do not like this. The combined hormonal ring is a flexible ring, 54 millimeter in diameter. It also releases estrogen and progesterone based chemicals, and the ring is self-inserted. Females do it themselves, put it in the vagina for 21 days, followed by 7-day hormone-free interval. Again, the same concept, right? So that's a diagram of a patch. You know, it has a feeling of getting something on your body, in your body type of thing. That is the ring, and then we talked about the drugs, pills. Many women I have seen, they prefer pills. Right. So missed pill, this is important because देखें जो pills का जो issue है, every treatment modality has its advantages, disadvantages. So for example, if somebody is on pills, इसका एक जो compliance का side है वो ये कि you have to take the pills continuously for 21 days and then leave it for 7. This is a lot of calendar manipulation. So अगर बीच में ये possible है ना, कोई दिन आपकी कोई pill रह जाए, this is very common, missed pills, right? So missed pills are common, and if 2 or more are missed, then this places a woman at risk of ovulation. So अगर 2 आपने मतलब एक भी वैसे छोड़नी तो नहीं चाहिए, अगर if you are achieving for high efficiency and high efficacy of contraception, so आपको कंप्लाइंस तो करनी होगी. मैं इस लेक्चर के स्टार्ट से इस पे एम्फसाइज कर रहा हूँ कि कंप्लाइंस इज़ वेरी इंपॉर्टेंट. आप कोई भी कॉन्ट्रासेप्टिव मोडालिटी चूज करें, लेकिन अगर कंप्लायंस नहीं है सो इट गोज मल्टीप्लाइड बाय ज़ीरो. सो कंप्लायंस इज इंपॉर्टेंट. अब अगर दो ही टैबलेट्स मिस कर दी हैं या दो से ज़्यादा, सीरियस स्टाफ. नाउ ओव्यूलेशन कैन हैपन, देयर इज अ रिस्क ऑफ अनइंटेंडेड प्रेगनेंसी. एडिशनल कॉन्ट्रासेप्टिव कवर सच एज कॉन्डम्स एंड एब्सटिनेंस इज रिक्वायर्ड फॉर द मोस्ट मोनोफेजिक. बट ये तो भूल गए ना, तो उनको थोड़ी याद होगा कि मैं भूल गया हूँ तो मैंने अब ये यूज़ करना है. Additional precautions are also required if the patch is not applied for 48 hours or ring for more than 3 hours if unprotected sexual intercourse has occurred. So, ओके क्या कह सकते हैं, अगर आपने 2 दिन में ड्रग्स मिस की हैं और इस दौरान आपने इंटरकोर्स कर लिया, थर्ड डे पे आपको याद आ गया कि ओ माय गॉड मैं तो ड्रग फ्री पीरियड पे थी, सो दिस इज देन समथिंग टू कंसिडर, राइट. इसी तरह पैचेस का है, इफ पैच इज नॉट देयर फॉर पर्टिकुलर टाइम पीरियड, इफ वेजिनल रिंग इज नॉट देयर फॉर 3 hours एंड यू हैड इंटरकोर्स, थिंक अबाउट इट. राउट ऑफ एडमिनिस्ट्रेशन ऑफ कॉन्ट्रासेप्टिव, इसमें कैसे कैसे हम यूज कर सकते हैं, अभी ये तो बात हमने की है. इट कैन बी ट्रांसडेर्मल, वेजिनल और पिल्स, राइट, एंड दीज आर द वंस व्हिच यू कैन इंसर्ट इनटू the female genital tract. Length of action. The length of action has influence on the acceptability and efficacy as shown in table 6.6. Where is table 6.6? हम कर चुके हैं table 6.6. Let me have a look. Yeah, that one. कि किस ड्रग का कितना एफिकेंसी है. सो दैट्स गुड यार. इनकी तो देखें कितनी अच्छी है जो इंट्रा यूट्राइन सिस्टम्स हैं, 3 year, 5 year, 10 year और मोर. सो इसीलिए इसको कहते हैं ना फिट एंड फॉरगेट. दैट्स द वर्ड दैट वी यूज. And fit and forget. This is one of the most efficacious method. It also reduces the chances of unintended pregnancy to less than 1%. I think the best one available, but many people just don't like it. पता नहीं अवेयरनेस का इशू है, क्या इशू है. राइट ये एक टेबल इंपॉर्टेंट है यार, बार बार मेरी नज़र से गुजर रहा है, इस पर थोड़ा टाइम लगाते हैं. दिस इज इन केस ऑफ आई थिंक मिस्ड पिल्स की गाइडलाइंस हैं. सो लेट्स गो थ्रू दैम. So if one pill has been missed more than 24 hours and up to, यानी एक, अब आपको पता लग गया है कि मेरे से एक गलती हो गई, एक दिन में ड्रग लेना भूल गई, एंड नाउ जस्ट कंटिन्यू योर कॉन्ट्रासेप्टिव कवर. अगले दिन से स्टार्ट करें. एक दिन का मिस पिल, you just move on, right? Or how you minimize the risk of pregnancy. Emergency contraception is not usually required because it's just one day. पिछली ड्रग का भी इफेक्ट है, so क्योंकि उसका टाइम पीरियड यूजुअली 24 hours है ना, so maybe you are fine. But if two or more than 2 days have been missed, 2 or more than 2 pills have been missed, and it's been more than 48 hours, now this is where you should think about contraceptive cover or maybe emergency contraception. Okay, you should, if you know this. Even sex should be avoided, or use condoms, for example, other methods of contraception to cover it. And then you should think about minimizing the risk of pregnancy. If pills are missed in the first week, this also depends upon when you miss the pills basically, right? क्योंकि मैं हमेशा ये बात करता हूँ ना कि day 1 से day 14, this is the ovulation day, and then day 28 is the menstrual day, right? So day 1 to 10 perhaps is the safe window. So अगर first week में pill miss की है, so that can be fine. You don't have to worry quite a lot. इसी तरह अगर day 20 से day 28 के बीच में पिल मिस की है, वैसे आखिरी के 7 days तो वैसे ही मिस करनी थी, राइट? तो शुरू में 20-21 दिन पे अगर मिस की है, दैट शुड ऑल्सो बी फाइन. बट अगर इसके अराउंड, यानी इसके 3 दिन इधर, इसके 3 दिन उधर, सो वी आर टॉकिंग अबाउट डे 11 टू डे 17, क्योंकि डे 14 पे ओव्यूलेशन होनी है ना. अगर ओव्यूलेशन पहले हुई तो ये वाला विंडो इंपॉर्टेंट हो गया. ओव्यूलेशन के बाद तो इसने करना ही है ना, 2-3 दिन तक ओवम ने स्टे करना है. सो 11 to 17 इज समथिंग सीरियस, राइट? ये टाइम पीरियड मेरे हिसाब से, आई मीन इन क्लिनिकल सिनेरियो में आपको बता रहा हूँ, एंड इट्स ऑलमोस्ट द सेम थिंग. 8 to 14 इज द टाइम जिसमें ओव्यूलेशन होनी है ना 14 पे. 15 to 21 में क्या केयर करनी है. सो it depends upon when the patient, but if it's only one pill missed, I would not worry too much about it. I would just be cautious but not do emergency contraception. Okay, then the cancer risks among the use of combined oral contraceptives, that is very well reported. The risk of cancer, 12% reduction in the risk of any cancer, reduced risk of colorectal cancers is a good benefits, right? They also increases some cancers. जैसे मैं बता रहा था, they can cause not we don't know if they really cause it, but we know that there is an increased chances of these cancers, such as breast cancer, and increased risk of cervical cancer, right? But they also have protective effects against these cancers. ये पूरे पैराग्राफ्स यही हैं जो अभी उस टेबल में समराइज किया है. सो रिमेंबर दिस टेबल बहुत इंपॉर्टेंट है. इट्स अ वेरी हाई ईल्ड टेबल कि विच कैंसर के इंसिडेंस रिड्यूस होता है विद द यूज ऑफ कंबाइंड ओरल कॉन्ट्रासेप्टिव्स. ओवेरियन का रिड्यूस होता है गाइस, राइट, और किन का बढ़ता है. सो ब्रेस्ट कैंसर एंड सर्वाइकल कैंसर. Okay. Now, this is association with the cancer. Now, there is also an important association of estrogen progesterone drugs with venous thromboembolism as well as arterial diseases. Now, these combined hormonal contraception, either you are using them as a pill or a patch or a ring, a vaginal ring, increases the tendency to thrombosis in both vein as well as arteries. So, please consider this. और ये particularly important है because progesterone formulations की हमारे पास कई generations हैं. So if you go beyond generation 2 progesterone drugs, there are high chances that these thrombotic events are increased. So we therefore use commonly up to generation 2. Now, risk of venous thromboembolism in users and non-users. So 5 in 10,000 in non-pregnant non-users were not using this, and 10 per 10 100,000 in COCP users. So this is just to give you an idea that there is an increase in thromboembolic events if somebody was on combined oral contraceptives. The risk of venous thromboembolism is greatest during the first year of the use, possibly due to unmasking of the inherited. So basically, pehla saal is serious, right? Arterial disease is much less common. Venous is more common. It is related to age and risk of strongly influenced by smoking. So reduce smoking, stop smoking immediately. Progesterone only contraceptive method, अभी तक जो हम बात कर रहे थे, that was the first category of contraception. So let me label it number 1. इसका मतलब है we talked about combined hormonal contraception. So combined का मतलब both estrogen and progesterone. Now let us talk about a method. Let me label it number 2, and this is the one which uses only progesterone. इसीलिए नाम है ना progesterone only. So progesterone only methods are available as oral, injectable, and implant and intrauterine system. All these variations, the mechanism of action of method and the bleeding pattern appear to depend on the dose of the progesterone that you use. Injectable, implant, and the POP devices inhibit ovulation. Mechanism इनका भी यही inhibit ovulation. Lower doses of POP formulations, POP मतलब progesterone only pills. They inhibit ovulation only inconsistently. All progesterone-only contraceptive methods, regardless of the route of administration, thicken the cervical mucus, so reducing the sperm penetrability and transport also. So they inhibit ovulation, but also increase the thickness at the cervix level. The levonorgestrel intrauterine system has little effect on ovarian activity, but it causes disruption of fertilization and implantation. Progestin only pill, implant, and ये वही बात चल रही है जो हम यहाँ brief किया था. यहाँ different categories. If you are using the drug which is progesterone only, this is unlike COCP which is combined. POP needs to be taken continuously. It's a very important differentiating factor. जब आप COCP लेते हैं तो आपको 7-day drug free period चाहिए, but यहाँ पे continuous लेना ही लेना है. Medium dose pills containing dosagestrel inhibit ovulation in 99% of the cycles. Side effects of all POP include possible irregular bleeding and persistent ovarian follicles. Some may develop cysts as well. If POP is missed, then the women should continue taking POP and then also use extra precautions. This is same as we discussed in combined oral contraceptives, right? Implants are there. Is a single rod such as Nexplanon containing a progesterone. Etonorgestrel is the currently available method in the UK. Contains 68 milligram progesterone, basically providing contraception for 3 years. That's all, right? That's how you insert the device. Progesterone only injectables are also available. So there are pills available, there are devices available which you can insert, implants जिनको हम कहते हैं, and then there are injectables. The most commonly used injectable worldwide is a depot injection of medroxyprogesterone acetate, which can be administered intramuscularly. If it is IM, then buttock, upper arm, lower abdomen is the area. As formulation, ये formulation का नाम आ गया जी, और ये उसकी वो आ गई. How does it look like? Okay, how do you inject? Woohoo, big needle. Both intramuscular and subcutaneous preparations may cause weight gain in a minority of women. You should be aware of this side effect. However, women should be advised that BMD loss seems to plateau. It will be fine for a few days, right? And it may be reversible. once you stop the contraception. Obviously, females don't go on contraception for the whole life. They define a period where they need contraception. There have been concerns over studies from countries of HIV prevalence, such as Africa, that have reported increased transmission and acquisition of HIV, those who were using progesterone. However, users of injectables are less likely to use condoms, so there may be a confounder. Okay, the increase in AIDS is perhaps because of क्योंकि आप इसको psychologically देखें ना, so if they are using one mode of contraception, which is progesterone only injection or drug, now they don't use condoms because they think that this is enough for contraception. No, because they don't use condom, there may be increased risk of HIV transmission. So maybe those who are linking the use of contraception to the HIV transmission are perhaps missing this confounder. The HIV increment is perhaps because of no use of condoms, right? As a sexually transmitted disease. Then we have releasing intrauterine system, जिसकी हम बात करते आए हैं. Intrauterine system such as Mirena, it's licensed for 5 years for contraceptive use, long term, very effective. It works by exerting a potential hormonal effect on the endometrium. It does not allow implantation to happen, does not prevent ovulation. Ovulation apni jagah hogi, even sometime fertilization apni jagah hogi, but implantation will not happen. Nothing new in there. We have talked about it. Intrauterine contraceptives, long term, prevent fertilization, impair cervical mute, inhibit implantation. So that's how they work. Now, intrauterine contraception methods include copper IUDs and LNGI. जो हमने अभी बात की है, they prevent implantation of the uterus के अंदर zygote का implantation, embryo का implantation को ये inhibit करते हैं, but sometimes they also stop. They disrupt the process of fertilization as well. Okay, so this is all nothing new in these paragraphs as well. How do they work? They stimulate an inflammatory reaction within the uterus, and because of the cytokines and the inflammatory environment, the fertilization and implantation does not happen. That's how it works. Bleeding patterns with IUDs. All the women with the intrauterine system tend to experience lighter, less painful menses. Women using copper-based IUD may experience more painful or heavier menses. The use of non-steroidal NSAIDs use करनी है अगर पेन वगैरह होता है. But usually it's not a major complaint. Women using IUD should be informed that their overall risk of ectopic pregnancy is much reduced compared with the women. So that's the good news for them, isn't it? However, if the pregnancy does occur with an IUD, the relative risk of that pregnancy being ectopic is higher, right? So their risk is lower as compared to the overall population, those who are not using contraception. But the point is, कॉन्ट्रासेप्शन का काम यही था ना ताकि फर्टिलाइजेशन ना हो, लेकिन अगर हो गई फर्टिलाइजेशन, then the risk of ectopic is higher. That makes sense, right? If women, so something which looks like a good news at the start is actually not. If women become pregnant with IUD in situ, an ultrasound scan should be conducted to exclude the ectopic pregnancy, because then their risk increases, right? Insertion of an IUD can be fitted at any point in the cycle. Doesn't matter, it's a luteal phase or whatever. There is no risk of pregnancy. Insertion is associated with the following risks. Perforation. Obviously, you are inserting something. You can perforate the uterus. That's not something uncommon, okay? Uterine perforation with insertion of IUD is rare. That's what they're saying, but I've seen a few cases really in my clinical practice. So this is not as rare as that. You will never see it. You will see it. 1 in 1,000. I mean, it's not too rare, believe me. Factors associated with an increased risk of perforation include relative inexperience. Obviously, if the person inserting the IUD is inexperienced, breastfeeding, being less than 6 months postpartum, things are fragile down there. Usually the women represent a missing thread, and the history of the severe pain follow the insertion. So thread is the, thread remains the icon of right placement. So if this is the uterus and the thread is there, so the female knows that the thread is there. If it's not in there, then where has it gone? So it has gone perforated and moved inside, because then the female comes with abdominal pain, peritonitis, and things like that. Expulsion in 1 in 20 IUD devices will be expelled out into the environment somewhere. It's just lost. It does not fit appropriately, okay? Infection is important to consider. The overall risk of pelvic infection in the first 3 weeks following IUD is low. Thereafter, the risk of infection is the same as women not using the contraception. So that's the bottom line that we have to actually advocate to the patients. Many patients come to the clinics with this background thinking and prefixed idea that if IUD is inserted, the chances of infections are high. Studies do not show the same. In most cases, IUD can be left in situ for a longer period of time. So overall, they're pretty safe, right? So infection is not higher as compared to the population which is not using contraception. So the point is, if there is a female who is using contraception, is prone to infection as equal as the female who is not using contraception. So we can conclude that contraception is not increasing the risk of infection. Missing thread may indicate pregnancy, expulsion, perforation. However, in often cases, the thread are merely sitting in the cervical canal or uterus all the time. A pregnancy test is always confirmatory. Okay, so these were the hormonal based methods where we talked about combined oral contraceptives. Then we talked about progesterone only pills or contraceptives. Now let's talk about the barrier contraception, which is the use of condoms. Obviously, these condoms are very cheap to afford, and in some countries they are in fact free as well, and they are widely available. They protect against the sexually transmitted infections such as HIV and others, and typical failure rates are in the region of 24%. This is high, but this absolutely depends upon how the user is using it. So compliance is very, very important, right? If the user is putting it correctly before penetration and before every act of sex. So ये जो failure rate है condoms का, which looks apparently high as 24%, may not necessarily be very high, because of the condom failure, but because of the usage, right? But the good news is it also prevents against sexually transmitted infections. So a female condom is also there, and a male condom which is put over the erect penis. And then there is a female condom as well, which basically acts like a bag, which does not allow sperm to enter into the female genital tract. So diaphragm in the cap. So that's the diaphragm in the cap, right? These are latex, non-latex devices inserted into the vagina, and basically they are physical barrier to sperm entry. Then spermicides almost alone is not recommended for the prevention of pregnancy, but some people put the spermicides on diaphragm or even the condom caps to prevent the viability and live entry of sperms. So basically they kill sperms. Okay. There is another method which we can use is female sterilization. It's a permanent method of contraception that prevents the sperm reaching the oocyte in the fallopian tube, because you are then, you are basically cutting off the way which is utilized by the sperm to enter towards the ovum. So that is what it is, female sterilization. Nowadays usually done by laparoscopically, and laparotomy is not usually done nowadays. It's a minimally invasive procedure. Laparoscopic sterilization is most commonly used, including the fallopian tubes. You just clip off the fallopian tube, so rasta hi band kar diya, right? That's how it is done. Advice to women considering sterilization: method is considered as irreversible. मतलब एक दफा हो गया तो सोच लें फैमिली तो नहीं बनानी थी आगे. There is a failure rate as well. Risk and complications are also there. Ectopic pregnancies and all these are associated. Higher proportion of women getting they regret sterilization at the end of the day. So this is the study, right? So ये आपको बताना चाहिए females को before they are deciding for permanent sterilization. Does not protect against STIs as condoms do. Effective contraception is required until menstrual period following laparoscopic procedure for 3 months. So काफी hectic procedure है, ऐसा भी नहीं है कि बिल्कुल ही जो है ना हल्का फुल्का है. But remember, it's almost irreversible, right? Once done, done. Hysteroscopic sterilization. This has advantage that it can be performed as an outpatient procedure without general anesthesia. For there, obviously, you need more anesthesia. हाँ? Patient को जागते हुए तो नहीं करेंगे. But again, आपको ये बताना है पेशेंट को कि क्या क्या रिस्क फैक्टर्स हैं. Vasectomy, that's for male. This technique of interrupting the vas deferens to provide permanent occlusion. There's no scalpel vasectomy, which involves a puncture wound in the skin of scrotum under local anesthesia and then to access and divide the vas deferens. So you just stop it, right? So you just disrupt vas deferens, and once you disrupt it, you disrupt the flow of sperm. That's how it is. Okay. Vasectomy. So you look at this diagram, nicely explains you the vas deferens. So sperms are all made here and they travel up there. So they are all made here. They cannot travel up there because you have broken the bridge. vasectomy. फर्टिलिटी अवेयरनेस, इसको तो नेचुरल फैमिली प्लानिंग जो मैंने बात कर ली है ऑलरेडी बहुत डिटेल में, डेट वाइज के 14 डे पे ओव्यूलेशन है, सो 3 days here 3 days here, you take care of those days. The best periods will be from 7 to 10 days, because this is where the previous menses stops, and this is a clean window. And then 20 to 28, that's a clean window as well. Okay. Calendar or rhythm method, fertile days are calculated, the same thing, right? That's the fertility based method. Temperature method, I mean very unreliable, I would say कि आज फीमेल का टेम्परेचर कितना है तो शायद ओव्यूलेशन हो रही होगी तो शायद कर लो, इस तरह नहीं यार. This is not gonna work if they are planning to avoid uninterrupted sexual activity. Well, this is not the way. Cervical mucus method. Again, this is not very subjective. I would avoid all these contraceptive procedures. They are very subjective, high failure rate. Personal fertility monitor. I mean, there are obviously these days there are devices and ICT based stuff available which actually measures or at least tells you about the metabolites of estrogen and LH in the urine. They tell you if the female is ovulating or not, if she is in the fertile period or not, and that is how you calculate if you should plan a pregnancy or otherwise. Okay, since we are talking about contraception, we are talking about preventing pregnancy. So these kits are routinely used. They're becoming popular, but again, they have a failure rate. Lactational amenorrhea, if a mother is within 6 months of postpartum, is amenorrheic and is fully or nearly fully breastfeeding, then the risk of pregnancy is about 2%, because she already has like prolactin, oxytocin stuff inhibiting ovulation. Emergency contraception, that's an important topic, and then we will, I think, move very quickly on the next part of this chapter, which is abortion. Emergency contraception is that despite using the contraceptions, if someone becomes pregnant, या ज़्यादा commonly scenario ये होता है कि a couple comes to you in the first 24 hours, for example, that we did not have any protection, there was no contraceptive mechanism that we were following, and we had intercourse. We don't want an uninterrupted pregnancy. This is where the emergency contraception comes into play, right? All women deserve a second chance to prevent an unintended pregnancy. The copper IUD is the most effective method for emergency. Remember, this is the most effective method because you disrupt implantation basically, right? Failure rate is very low, and should ideally be offered as the first choice to the women. When used for emergency contraception, its effect on endometrium is thought to prevent implantation if fertilization has happened. It makes sense. The copper IUD can be removed once pregnancy has been excluded. मतलब आपने एक दफा, the couple comes to you and the female says that I do not want this unintended pregnancy. You put an IUD and you monitor it for some time, and then you can remove it if there is no pregnancy. You confirm it, right? Okay, then since the blastocyst will implant between 6 to 10 days after fertilization, emergency IUD can be inserted up to 5 days, and then you check for it and then you remove it. The two oral methods of emergency contraception. So this was the device insertion, but there are two oral methods also. One is 1.5 milligram levonorgestrel and progesterone receptor modulator, ulipristal acetate, also high dose, 30 mg. It appears to be, LNG appears to be very effective up to 96 hours after unprotected sex. So remember these two drugs, and remember IUD. Okay, emergency contraceptive, the most effective, remember, is the IUD. That's the most important thing. But then also you have UP and LNG as drugs. Opportunities to provide contraception. There are important opportunities to discuss and provide effective contraception. Women present to you to the gynecology clinics. You should explain what are the methods available, what are the side effects, when to use which one. You should explain emergency contraception. And if there are any requests for abortion, then we can talk about those options, and we'll discuss this in a minute. हमारे chapter का next part वही है. Given the wide range of existing contraceptive methods and delivery systems and hormonal methods which are established, do we really need method of contraceptions? We should remember that even high-income countries, unintended pregnancy rate is very high, and that leads to maternal and fetal mortalities and morbidity. So yes, इसकी अवेयरनेस भी होनी चाहिए, एंड फर्दर इस पर रिसर्च होके न्यू मोडालिटीज भी आइडेंटिफाई होनी चाहिए. द की लर्निंग पॉइंट्स हियर वर, in sexually active women, contraception is required until a woman reaches the menopause. The long-acting reversible methods, which are called LARCs, are currently very effective, but there are myths associated with them. Many people avoid them. Uptake of contraception and continuation is limited by acceptability to the user. User is the key point here. Compliance is very, very important. Okay, if no contraceptive method is used or a method fails, the woman needs easy access to emergency contraception. हमने यहाँ बात तो की कि emergency contraception के लिए we use IUD as the first line, is the most effective, but then two drugs are also available. But this again is a myth and a taboo in many societies. Females just don't talk about this, even if they need emergency contraception, but they don't usually talk about it because they think it is something really so bad, right? Okay, now let's talk about abortion. No method of contraception is perfect, and it may ultimately lead to unintended pregnancy. And in order to get rid of the unintended pregnancy, this is called abortion. And medically doing it, ethically doing it, this is called safe abortion. It saves mother's life and prevent the severe morbidity associated with unsafe abortion. क्योंकि अगर ये आप देखें, इसका पॉइंट ये है कि imagine a female who was using contraception, or say for example not using contraception, but now she is pregnant, but she labels it as an unintended pregnancy. So she never wanted this pregnancy for any reason, but now she's pregnant. Now she will be thinking to get rid of this unintended pregnancy. There are two routes available. One, ये छुप छुपा के unsafe practices घर पे इसको किसी तरह remove करें. दूसरा, इसकी medical proper hospital में जाके help seek की जाए. तो this is safer ना, बजाय इसके कि आप unsafe practices घर पे ये कोई practice करें, कोई कहता है ये कर लो, कोई कहता है वो कर लो, इस तरह जो है ना बच्चा जाया कर लो. So all they're very unsafe and they should not be encouraged, right? What is the UK abortion law? As the book originates from there, it talks about UK law. In 1967, Abortion Act stated that abortion can be performed if two registered medical practitioners are in good faith agree that the pregnancy should be terminated on one of the recognized legal grounds. और वो recognized legal grounds यहाँ listed है, अभी पढ़ता हूँ. There is actually no medical need for the two doctors to be involved, and the British Medical Association Ethics Committee have argued that the law should be changed to reflect this. It's still not changed, I think. Any medical practitioner who has an objection to abortion is not required to participate in the abortion services. जरूरी नहीं एक बंदा कहे मैं नहीं पार्टिसिपेट करना चाहता. Obviously ये तो medical ethics है. However, a medical practitioner who conscientiously objects to abortion should still provide advice. Advice तो दे सकता है and refer a woman to some other fellow colleague, right? अब वो कौन सी legal grounds हैं for abortion? These are important considerations. First one, continuance of pregnancy would involve the risk of life of the patient, right? So this is very important clinical ground. If this is present, if there is a condition कि अगर ये pregnancy continue हुई तो life threatening हो सकती है, it should be terminated. Termination is necessary to prevent grave permanent injury, physical or mental, to the women health again. Pregnancy has not exceeded its 24th week, and continuation of the pregnancy would involve risk. Again, there is a timeline now, and then they are also talking about if there are risk to the patient. Patient in this case is the pregnant female. Pregnancy has not exceeded 24th week, and continuation of the pregnancy would involve the risk greater than if pregnancy were terminated. So you decide for termination. There is a substantial risk that if the child were born, it would suffer from such physical or mental abnormalities. So this is an important legal clause as well. To save the life of the pregnant women, to prevent grave permanent injury, physical or mental, to the pregnant women. So primarily they are putting all the emphasis on mental or physical health of the pregnant women, but they also take care of if the baby is then at risk of mental and physical trauma. So these are all the grounds covering in cases में abortion is legal. Okay. Now, pre-abortion investigation, obviously, you do the gestational investigation. सारे आप करेंगे जो routine blood counts and ultrasounds and all these things, you do that, right? The vast majority of all abortions in the UK are carried out under control under Ground C. So Ground C was what? Ground C was pregnancy is not over 24 weeks, and continuation would involve the risk greater than if the pregnancy was terminated, right? So that ground, abortion is done. With approximately 1% carried for serious fetal abnormality, ground E, so that's not important actually. The Royal College of OBGYN guidelines on the care of women requesting for abortion recommends that services should be organized so as to minimize the delay at early gestation. So as early as good, right? Methods of abortion कौन से हैं? That's important. ये medical abortion and surgical abortion है, ये सुन लो जरा, ठीक है? सेफ अबॉर्शन की जो मेथड्स हैं दे आर आइदर दे आर नाइदर मेडिकल नॉर सर्जिकल इज अ कॉम्प्लेक्स प्रोसीजर दोनों सिंपल प्रोसीजर्स हैं एंड बोथ ऑफ देम हैव वेरी लो रेट ऑफ कॉम्प्लिकेशंस इंडीड WHO advised that in the first trimester it can be safely performed by a range of healthcare providers from a specialist OBGYN practitioner to a non-specialist doctor as well. Both medical and surgical methods can be used to induce abortion throughout pregnancy. The choice of method which has to be used depends on the factors such as kitna gestation age hai, what are the pre-existing medical conditions, what is the preference by the women, and locally वो skills मौजूद हैं भी कि नहीं. पता चले आप एक बहुत बड़ी सर्जरी प्लान करके बैठे हैं, सर्जन्स हैं ही नहीं, right? So अभी हम करेंगे ये कि we'll talk a little about medical abortion की techniques and then surgical. Majority of the women undergoing abortion in the UK choose to have abortion performed medically because surgery से वैसे ही बंदा डर घबरा जाता है, right? This involves the combination of mifepristone, that's a progesterone receptor modulator, followed by prostaglandin analog, which is misoprostol. So progesterone is necessary to maintain the uterine quiescence. So administration of mifepristone brings about an increase in the uterine contractility. So imagine there is a uterus having the implant, and then you suddenly give mifepristone, increase contractility, and then it is expelled out. This is how it works. The effect of mifepristone maximal at 48 hours. So if misoprostol is administered at an interval of 24 to 48 hours later, then there is increase in the cramping pain, bleeding, expulsion of the fetus. This is how it works simply, right? And this is taken care by simple oral analgesia. Rarely they require IMs or IV controls. Now, women can be advised that at 9 weeks gestation, they will bleed for an average of 2 weeks following the medical abortion. After 9 weeks of gestation, the same combination of mifepristone and misoprostol is used, except that the regime required repeated dose of misoprostol. So it has to be done again, sometimes repeatedly, okay? In the second trimester, the average induction to abortion time is about 7 hours. So it's not usually a one-time procedure. You have to repeat it to make sure that everything is expelled out. After 21 completed weeks, the RCOG recommends that for women undergoing medical abortion, feticide should be used to eliminate the possibility of the aborted fetus displaying the signs of life. So you make sure this is done. Now, again, this is a very sensitive topic in some cultural and religious backgrounds, but I mean, that's how medicine works. Then there are surgical. So there are medical methods. Basically, what you are doing, you are increasing the contractility, you are trying to expel everything out, and if it is advanced stage, you are also using something to kill the fetus, basically, and then expel it out. Okay. Then there are surgical methods available. For example, there is vacuum aspiration is the method that should be used to conduct a surgical termination of the pregnancy up to 14 weeks, right? And the procedure involves gently dilating the cervix with graduated dilators and then evacuating the cavity with gentle suction. This usually takes less than 10 minutes to perform. Sharp curettage should never be performed because it's a uterine perforation ho jati hai. See, these are the points which make the hospital abortion safer as compared to the unsafe mechanism. I once saw a case in my clinical practice that was horrible. I was doing my internship in surgery and we saw a patient jiski yaar history dated back to this unsafe abortion. So she got unintended pregnancy, and then at their home some dye and someone came that tried to pull out the fetus in an attempt to make abortion. Perforated uterus went inside and they were pulling at the end of the day intestine out of vagina. Oh my god. I mean, then this poor lady, I mean, she died at the end of the day and she was admitted in surgery. Her loops of intestine, they had to be cut and then anastomosed and then multiple operations. She could not survive at the end of the day. So ये हम बाजों का इतना मेडिसिन में चीज़ें पढ़ रहे होते हैं, बड़े मज़े से पढ़ के आगे निकल जाते हैं, but when you see them in real life in clinical practice, then you see the real pain and importance of these words. Okay. Surgical termination can be performed under either local anesthesia, or if the patient is not cooperative and you are having difficulty, maybe general anesthesia is the answer. Local anesthesia in the first trimester is preferred as it minimizes any small risk of anesthetic drug. It is important to consider pre-treatment of the subject. So these are all details which are not perhaps important. The bottom line, you are doing vacuum aspiration. डायलेशन एंड इवैक्यूएशन आफ्टर 14 वीक्स, टाइम लाइन इंपॉर्टेंट है हर जगह जो दिए है ना, 14 वीक्स तक क्या करना है, 14 वीक्स के बाद क्या करना है, इस पे तो सारा गेम है. The surgical technique of choice is dilation and evacuation. That if pregnancy has gestation age has crossed 14 weeks. In skilled hands, this procedure has a low complication rate, but in skilled hands, okay, it is necessary to achieve good cervical dilatation before the procedure up to 20 millimeter in order to remove the larger fetal parts. So basically, you are dilating and taking everything out, right? Evacuation. Sequelae of abortion, both medical and surgical abortion are safe with low incidence of complications. So they are easy procedures, safe procedures comparatively if done appropriately. Complications, when they do occur, include failure to end the pregnancy. So you did everything, but the pregnancy is still there. That's the horrible thing. There is no association with future infertility and ectopics. So ये भी एक myth है अक्सर कि एक दफ़ा अगर abortion करा लिया तो आइंदा बेबी नहीं होगा. ऐसा कुछ नहीं है. There is no association with breast cancer. आप कोई hormones वगैरह थोड़ी insert कर रहे हो यार. तो ये सारे myths हैं जो associated हैं abortion के साथ. And obviously, like any other procedure, follow-ups are good, but usually there is no need for like hard and fast follow-up. It's good to have follow-up, but it's not actually required. There's no medical need for follow-up after uncomplicated abortion. So it's fine. You go, you live your life, right? Post-abortal contraception. Most women ovulate in the first month of the abortion because abortion is not intervening with the HPO axis at all. It's simply, most of it is a physical procedure. Even if the medical drugs are being used, it still is a physical procedure, right? Because आप क्या कर रहे हैं medical drugs में? You are contracting the uterus to get the things out, है ना? There is evidence that women who choose to use most effective LARC post-abortion have significantly reduced risk of subsequent. So basically, मैं अगर इसको summarize करूँ तो point ये है यहाँ पे कि अगर abortion करवाई है, right from the next cycle they can use almost whatever contraceptive technique they want to use. LARC being the most effective in females who never had abortion. It is also effective in females who have abortion. So this is as simple as that, okay? So that's all about this chapter. Was pretty important, huh? Some case histories at the end of the 10 teachers. Always at the end of every chapter you have some case history. So there's a 44-year-old woman here. She requests for sterilization as she does not want any more children. She has 3 children already. Her partner will not consider vasectomy. उसने मना कर दिया. She has regular but heavy menses. She is currently using no method of contraception. She smokes and she suffers from migraine as well. What are the key points to cover in counseling on sterilization? आपको मैंने ऊपर एक टेबल बताया था ना कि ये irreversible है, इसमें complications ये हो सकती हैं वगैरह वगैरह, सारी बातें उसको बतानी है. What alternative methods of contraception might be appropriate for the women and what method of contraception is she not medically eligible for? Not medically eligible for, यहाँ आपको ये स्मोक करती है तो आपको पता होना चाहिए कि प्रोजेस्टेरॉन वगैरह मसला कर सकते हैं, राइट? तो इट्स द सेम थिंग जो हमने ऊपर डिस्कस की है. इन तीनों को आपने ये आंसर पढ़ें और डिस्कस करें, राइट? परहैप्स इंट्रायूट्राइन वुड बी द मोस्ट अप्रोप्रिएट फॉर दिस लेडी. ओके, ये केस पढ़ते हैं यार. A 19-year-old woman who previously had a medical abortion attends a clinic requesting for contraception. She is now 19 years old. She is overweight and has acne. And has no other medical history. Her mother had deep venous thrombosis after childbirth. Which of the following is not a suitable method for her? Not a suitable method for her, okay? Because उसको family history है DVT की, that's a problem. There may be coagulopathy, so I would be very much concerned about the combined hormonal pill. This would be something where I would be cautious, right? The family history of DVT in a first degree relative is a contraindication to all combined hormonals. So as simple as that. Okay, a 29-old female requesting for contraception. She is known to have polycystic ovarian and she struggles with acne and hirsutism. She would likely to have a baby in 12 months time. She has no other medical condition. What would be the best contraceptive option for her? Choose the single best answer. इसको PCOS है, so combined benefit मिलेगा if you use combined oral contraceptives because it will not only offer contraception but will also take care of PCOS. ये हमने पढ़ रखा है already. Okay, so that's all about this chapter. आपसे मुलाकात होगी अब next chapter में, which is chapter number 7 on subfertility. So all the very best till I see you next.